Good morning, Dr. Akariza. This is Max from the OB ward. I'm calling about a postpartum patient in bed number 3. A 28-year-old female, Reina Minea, who is experiencing postpartum hemorrhage.
Good morning, Max. Can you give me some background on the patient?
Reina was admitted 2 days ago for a normal vaginal delivery. The baby was born at 38 weeks gestation and there were no complications during labor. She has no significant medical history but is at risk for hemorrhage due to prolonged labor. She has been experiencing heavy bleeding since delivery and with total blood loss of approximately 500 ml, and the bleeding is still ongoing.
Good. What are her current vital signs?
Her current vital signs are: the blood pressure is 90/60, pulse is 110 beats per minute, respirations are 18, and her temperature is 37.1 degrees Celsius. And she is a bit pale but alert.
Sounds like a moderate hemorrhage. What's her hemoglobin level?
Her hemoglobin level is 9.5 gram per deciliter, which is slightly low. We've started IV fluids and oxytocin as per protocol, but the bleeding hasn't slowed down much. There's no sign of shock yet.
Is the uterine firm or soft?
The uterus is soft and atonic upon palpation, and there are no signs of retained products of conception. Doctor, I recommend that we administer additional uterotonics to help control the bleeding. Given her hemoglobin level, would you consider a blood transfusion? I'm also concerned about the possibility of surgical intervention if bleeding persists.
Okay, I agree with starting additional uterotonics. Let's keep monitoring her closely for any signs of shock. If the bleeding continues, I will consider a transfusion or surgical consult.
Will do, doctor. I'll keep you updated and call if there are any changes. Thank you.
Good morning, Dr. Kabamangan. This is Nurse Saki from the medical ward. I'm calling regarding Noel Del Pilar, a 74-year-old patient in room 204. He has type 2 diabetes mellitus and is currently experiencing a hypoglycemic episode. His blood glucose level is at 50 mg deciliter. He is drowsy but responsive, diaphoretic, and weak. There are no signs of seizures or loss of consciousness, but I am concerned about his condition and the risk of worsening.
Alright, I understand. Can you give me some background information on the patient?
Mr. Del Pilar was admitted 3 days ago due to pneumonia. He has a history of hypertension and diabetes and has been receiving insulin therapy. His last meal was about 5 hours ago and he received his usual dose of insulin 2 hours ago. He has no known drug allergies. His IV fluid is D5 0.9 sodium chloride running at 80 ml per hour. He has been compliant with his medications, but his current condition suggests he may need immediate intervention.
Got it. What are his latest vital signs?
His most recent vital signs are as follows: blood pressure of 110/70, heart rate of 98 beats per minute, respiratory rate of 18 breaths per minute, temperature of 36.7 Celsius, and oxygen saturation of 98% on room air. Upon assessment, the patient is still conscious but lethargic. His skin is cold and clammy, and he does not exhibit respiratory distress, and his heart rhythm remains regular. However, his weakness and diaphoresis indicate that his hypoglycemia needs immediate correction.
Okay, thank you for the assessment. Now, what do you think would you recommend?
Since the patient is still conscious, I recommend administering a fast-acting glucose source. I suggest giving 15 grams of oral glucose if he can tolerate it. If he is unable to take it orally or if his condition worsens, I recommend administering 25 to 50 ml of dextrose 50% IV push. Additionally, I will closely monitor his blood sugar levels and reassess in 15 minutes. Would you like me to hold his insulin for now, Dr. Kabamongan?
Yes. Hold his insulin for now. Administer the oral glucose first, and if necessary, proceed with the IV dextrose. And also recheck his blood glucose in 15 minutes and repeat the treatment if needed. Nurse, please update me on his condition and notify me immediately if his symptoms worsen.
Understood, Dr. Cabamongan. I will administer the glucose now and continue monitoring his response. I will call you back if there are any further concerns or if his blood sugar does not improve.
Yes, that sounds like a plan. If his condition does not stabilize, notify me immediately. Okay? Okay, goodbye.